There you go. Hello, everyone. Again, happy Monday. If you don't mind going to the next slide, Michelle.
Yep.
So I just want to make a quick note. So this presentation is going to focus on targeted investments justice 2.0, what we refer to as TIP Justice 2.0. This is a fairly nuanced program of the Targeted Investments 2.0 program. And so we strongly encourage folks that are not interested in participating with justice specifically to also attend another focus group session. I believe the next one is on June 5th, which will be not justice specific, if you will. We also have a recording posted to our website right underneath the registration links that we encourage you to watch. It is this exact video, but not justice specific, in case you want to peruse it and get some of the updated info. Again, there's going to be some nuances that we talk about for justice here, and really making sure that we can address any questions and get to that content specifically here today. So that said, I do want to level set for Target Investments 1.0, the program that prefaced the TI 2.0 program, as you can imagine. Really focused on integration and coordination of primary care and behavioral health care, really at the provider level. Really wanted to ensure that we could coordinate services as much as we could for Access members, and really complementing the Access Complete Care integration of the health plans, really at the provider level here. Go to the next slide. So in TI 1.0, again, that went from 2016 through 2022. There was a justice program specifically, so it also focused on integration, coordination of primary care and behavioral health, and it also focused on an array of other initiatives and milestones specific to individuals transitioning from the criminal justice system, jail or prison. And so you can see a few of those services here. Really had a lot of great work that happened in TI 1.0. I got to give a big shout out to all the organizations that participated in the 13 clinics. We're going to get to those here in a second, but they really championed these efforts, and we really were able to help a lot of individuals, receive the care that they need and successfully re-enter the community. Next slide, please. So as we go into TI 2.0, it officially started October 2022. It's going to run through September 2027. We're going to build off of the TI 1.0 program. So we will still have that coordination and integration of, trying to address an individual's whole person care needs. So primary care and behavioral health, but we're adding a third domain to it. So that's going to be health-related social needs. Health-related social needs are a subset of social determinants of health that negatively impact an individual's livelihood. And so in TI 2.0, then, to really embark on that, we are going to focus on ensuring that an individual is screened and referred to if they want, to a referral service to meet that need. And we also want to take a look to see if, we want to ensure that individuals are receiving, their care. Taking a step back here. We want to ensure that there's health equity amongst the patient population and Access members. And so there's going to be a real large focus in TI 2.0 on health equity and addressing any inequities that are identified. And so that'll include ensuring that we are delivering culturally and linguistically appropriate services. Be one of the milestones that we focus a lot on as well. Next slide. So those initiatives apply across the board to all TI 2.0 programs, primary care, behavioral health, as well as justice. Justice clinics themselves will also have these initiatives here. So looking at tobacco cessation programming to complement the new Ashline vendor, and identifying inequities specific for individuals involved in the criminal justice system. Also, there's going to be a focus on coordinating early reach-in activities. Right now, the health plans, ACC plans, are conducting reach-in into really engaging individuals that are incarcerated in jail or in prison, after a certain amount of time. And so having the TIP Justice participants really try and engage folks sooner, and then coordinate with the those health plans and others that are going to coordinate that individual's care upon release and re-enter into the community, is going to be really important, critical, to ensuring that we can set that individual up for success and get them the services needed to, hopefully, again, promote success into the community here. Next slide, please. So TI 2.0 participation slightly varied from TI 1.0. Next slide, please. In TI 1.0 really was a completely new concept of really trying to integrate healthcare and being able to find ways to best engage individuals transitioning from criminal justice system. And so one of the ways that was really proposed and really what took hold here is co-located clinics, clinics that provide behavioral health and primary care that would be co-located with or near a probation office or a parole office, so that an individual going in to meet their community service requirement would also be able to receive some of that screening, or referrals or other services that they may need that they may not have the time or otherwise interest in pursuing, had that not been as convenient. And so we had worked with the Access regional behavioral health authorities of the behavioral health plans at the time to identify best clinics and partners back in 2016 to champion this work. You can see a map here. We got 6 different counties plus the Arizona Department of Corrections that really participated. And again, they did great things, 13 clinics throughout the state, really enabled to serve many individuals. So one caveat, I guess you could say, of that model, that one-stop shop, the co-location, is the public health emergency made that rather difficult. With COVID-19, some of the community supervision requirements were no longer held in person. Many clinics were across the state were really required to shut down for a small period of time. And so we kind of pokes a hole in the one-stop shop model, if an individual doesn't have to go into their community supervision requirement any longer. But what we noticed is that the TIP Justice clinics really worked with their criminal justice partners, in order to adapt to, the current environment and whatever needs were coming up. And so they were really being able to leverage their partnership, that they've built over the past few years in order to continue the great work that they were doing. Next slide, please. So as we look to expand the pilot, if you will, into TI 2.0, we have another 5 years. It's $250 million across all projects, programs with NTI. We are going to continue focusing on clinics that are able to provide readily accessible behavioral health and primary care services. So really looking at ICs, FQHCs, RHCs, and 77s. But we are a little flexible in telehealth delivery as well. So we are going to maintain a requirement of working with a county or state or county probation or state parole as a justice partner. But we're also encouraging clinics to expand the scope of justice partners that you're working with as well, to engage folks with diverse criminogenic needs, criminogenic risk, and be able to help more individuals succeed in the community here. So we learned from our TI 1.0 experience, again with COVID-19, unfortunately, making the co-location piece a little bit more challenging. We noticed the collaboration was really important, and something that we can leverage into TI 2.0 for continuing that participation in a flexible and meaningful way. This is especially important as we look at engaging more county partners and more clinics in more rural frontier communities, where maybe a single one-stop shop or a single co-located clinic may not be the best strategy to engage the population. Next slide, please. So we've had a lot of interest in the program, which is not a bad problem. But we do want to make sure that it's a meaningful incentive. You know, if we accepted all of the folks that had applied or that are interested in participating in TIP 2.0 Justice, then, you know, everybody might get $5 each, and that would not be a very meaningful incentive. We wouldn't be able to keep a lot of clinics at the table. And so what we're doing is a competitive application process. So any clinic that is interested in participating in TIP Justice specifically is going to need to submit a commitment letter by the end of the application period, September 30th of this year, in order to demonstrate, you know, what their plan is to serve the justice-involved population in a specific community, you know, in the next 5 years, if accepted in a TIP 2.0 Justice here. And so we're going to review those commitment letters, and we're going to select those that best serve the community and have the strongest commitment and you know, procedures and processes between the clinic and the justice partners themselves. And so again, we're not going to require co-location, but it needs to be, you know, your partnership needs to be pretty close to that level of collaboration, coordination, you know, to where you're able to, you know, really share data and share processes that are as seamless as possible. So there are application criteria there. I strongly encourage you to take a look at those. There are some required elements that we need to know in your commitment letter, as far as the, you know, name of the clinic and a provider ID, and you know, who your criminal justice partner is. But we also, you know, put some optional services there, if you will. Really services that are going to be applicable, most applicable to individuals transitioning from the criminal justice system, and being able to, you know, stand out your application from others that are also submitting an application for the population that you're trying to serve. So we're going to score those objectively and select the clinics that best meet the needs of the area. Next slide, please. And so, again, really asking the justice partners, I didn't see any on the invite initially, but in case anybody has joined us, really encouraging justice partners, justice agencies to work with providers to explore this opportunity. You know, a justice partner may work with multiple organizations in hopes that, you know, at least one of them is approved, you know, for one of their clinics. You know, ultimately, at the end of the day, if we're selecting multiple clinics with a specific justice partner, we're going to give that justice partner a call and make sure that they have the bandwidth to, you know, support and to continue that partnership with all of those plans being approved for the program. Next slide, please. So we are accepting applications for any individuals, any clinics that are going to be open by September 30th, 2023 through the application portal itself. Application portal is in development. It'll be available in summer. We'll let you know when that is. If you are not expected to be open before September 30th, 2023, but you will be open, expected to be open before September 30th, 2024, we are also encouraging folks to submit an application letter through email. And so it'll have the same requirements as commitment letters. So strongly encourage you to take a look at those, but they will be submitted through email, embedded the same way, in a way that we are looking at the proposal or proposed services that will be offered. That clinic must be open and must contract with all health plans by the end of year 2, which is September 30th, 2024, in order to participate in the program. All right, next slide, please. So looking at the timeline here, we are currently in the onboarding application phase. We go by federal fiscal years, October through September. You can see in the coming years, it models TI 1.0 for those that did participate, years 2 and 3, establishing systems and protocols and implementing them, and then performance measures in year 4 and 5. We do have performance measures starting a bit earlier here in TI 2.0. We're going to get on that in just a second. Next slide. So as we go into the application onboarding, again, year 1 currently. Next slide, please. There's a few items that I want to make sure that we touch on. Once more, I'm going to tell you, and several more times in this presentation, the application portal is going to close September 30th, 2023 at 5 p.m. So make sure you get your applications into the portal by then. If you do not have a provider ID yet, or it's a pending clinic, you have to send us that email by 5 o'clock. Obviously, I don't have a way of not accepting emails after 5, but we will not be accepting or considering any applications that come in at 5:01. Other application requirements here is that you do need to meet an EHR requirement and connectivity to the HIE. That has been updated this past couple of weeks, so we're going to get that to another slide here in a second. And you're going to need to upload supporting documentation for participating in the program itself. So really for Justice, we're just looking at that commitment letter and ensuring that that's meeting the minimum required criteria and looking for those optional criteria and services. If you are approved, clinics that are approved for the program will be notified by December. We want to get those a quick turnaround so that you can work with your Justice partner to implement everything that you committed to. And we're going to disperse those payments as soon as we can calculate them. We're hoping for early 2024. It might be closer to the summer 2024. Still sketching out that timeline here. But want to get those funds, that seed money to you as soon as we can. Next slide, please. So I promise we get back to the EHR requirement. So Contexture is setting up a new HIE platform that they're planning to launch in 2025. So because of that, they're not accepting new scopes of work to connect to the current HIE platform. And so really excited for the new platform. It's supposed to be a lot more streamlined, a lot more functionality, and work with a lot more EHR systems, which will be great. And so we really wanted to be flexible with our application criteria here to allow any folks to submit an application for CHIP Justice. If you have an EHR system, so kind of one of two ways here. Either you have an EHR system that's capable of sending and receiving information to Contexture, the Health Information Exchange now. If that's the case, you just need to get a signed scope of work with Contexture that you will connect to the new platform once it's available. If you do not have an EHR system currently capable of that, we are asking you to submit another commitment letter, separate than the first one, really from the organization's leadership to tell us which EHR system is currently in the works, and committing to doing a scope of work with Contexture and connecting to their new platform as soon as it's available. And so that's really going to help out folks that are in the middle of transitioning EHR systems or those that are really hoping to take advantage of that in the next couple of years. Next slide, please. Program deliverables. I'm going to fly through these fairly quickly. The next slide, please. So again, years 2 and 3, creating processes and protocols. We have an example here in a second. We try to be very flexible with the processes needing to include certain minimum criteria, but not necessarily telling practices who needs to do those processes or how that needs to occur. So again, we'll have a example here in just a minute. We have performance measures years 2 through 5 of TI 2.0 program, really focusing on moving the needle for the population in a specific health outcome. Those measures and how we're going to stratify those measures is still up for discussion. CMS wants to be much more at the table here. And so we are working with them as closely as we can, trying to get a finalized measure slate out for review and some comment as soon as we can. Next slide, please. So here is the example that I was mentioning for years 2 and 3 for a process. So here is the early region process milestone. And so I'm going to read this whole thing to you. I trust you can read. If you can't, then give me a call and I can make sure that we cover it much more in detail. Again, we are in the milestone creation phase right now, and so this is a great time to get feedback in order to make this as meaningful and feasible as possible. So you can see the minimum criteria that we're requiring for the early region component, and by year 3, implementing those procedures that were created in year 2 at least 85% of the time or so. Again, this flexibility is very important for tip justice as you work with criminal justice agencies that have very different roles in the community or very different perspectives. One county is maybe set up much differently than another county, and so really try to give you that flexibility here and work with you in order to ensure that we're able to meet the initiative in a meaningful and feasible way. Next slide, please. So performance measures, again, from years 2 through 5, still in discussion with CMS on them. I don't have much others to share. This is the TI 1.0 measures that we would like to stick to as much as possible. These measures align with other national stewards. They are prescribed criteria by NCQA. They align with MCL withhold measures or with other core measures that access is held to. And so the intent here is to land on measures that are going to be really applicable to the justice involved community, but also trying to align measures so that you're not torn into another performance measure target that you have to learn a new measure and focus more staff time on yet another new initiative, if you will. And so we are trying again to focus on TI 1.0 measures here so that as we look at addressing health inequities, we can use a lot of the lessons learned from the best practices from the TI 1.0 experience and really looking to close any inequities that are identified instead of learning a new measure and trying to do that. Next slide, please. And so with that, I will just make one quick note. If you are a justice partner or a TIP Justice, potential TIP 2.0 Justice Clinic on the call here, please work with your justice partners, to see if there are alternative metrics that would be valuable for the community in order to demonstrate the impact of this program. We recognize that NCQA HEDIS healthcare measures are not always as meaningful to some community providers, and understandably, but there are other outcomes, that may be noticed or may be more valuable to report on that could really help the community partners, continue the program or even expand upon it. So if you have any examples on those, please let us know. Happy to talk them over. The big thing, though, is that you do need to make sure that you have data related to those measures. And so as you work with your criminal justice partner in submitting a commitment letter, just mind that you will need to receive any data, for example, related to recidivism rates, however you operationalize it. You'll want to make sure that you're receiving the data in order to calculate that. Access is somewhat limited on some of the information we receive. And so we will help calculate metrics for anything where the data is available through data we already have or data that's supplied as part of your partnership. All right, I'm going to stop talking for a little bit as we go to the next slide and hand it over to the ASU team for technical assistance.
Yeah, thank you. Hello, everyone. This is Samantha from the ASU TipQuick team. We will be continuing to partner with the Access TI team to provide technical assistance to TI participants throughout the next phase of TI. Over the next few slides, I'll discuss some of the various ways as a TI participant that you can get support from the ASU TipQuick team of data scientists and subject matter experts. So next slide, please. In year 1 of TI 2.0, participants can receive application support and assistance from the ASU TipQuick team. You can request document review and application feedback, as well as application portal submission assistance. The expectation for providing assistance with document review and application feedback is that providers will submit material that is nearly complete or as close as possible to the final expected application submission, so that the feedback will be most meaningful. And in order to secure this assistance, participants can submit a provider interest form. To secure document review and feedback for providers participating in the justice area of concentration in particular, the provider interest form must be submitted before June 30th, 2023, and for primary care and behavioral health providers, the provider interest form must be submitted before August 30th, 2023. Early submission of the provider interest form is highly encouraged because after August 30th, document review and feedback will no longer be available. As such, the only technical assistance available after August 30th deadline will be application portal assistance. If you do require assistance with the application portal submission process, you will need to submit the provider interest form by September 25th. And for those of you who download this presentation slide deck, you can definitely click on those yellow buttons located on the right-hand side to submit the provider interest form and to subscribe to the TI newsletter so that you will receive the latest TI news and reminders of important deadlines. Next slide, please. Once participants are onboarded into the TI program, ASU also supports participants with individualized technical assistance as requested for process-based quality improvement assistance. We also provide internal reporting review. We develop and disseminate best practice guides, and we will provide assistance with TI onboarding when new team members join your team. Next slide, please. The ASU TipQuick team also leads peer learning collaborative sessions throughout the program. Each session has a pre-selected topic, and in addition to the provider network, there are TI representatives from MCOs, CBOs, Access, and ASU at these sessions. Participants have the opportunity to engage in networking and problem solving with other professionals in the field. These sessions offer valuable opportunities to evaluate performance on particular quality measures and provide feedback on performance improvement, and are designed to meet the needs of TI participants as needed. Participants are also able to receive continuing education credits, CEs, for their participation. Next slide, please. Thank you.
We're going to be wrapping up by summarizing the important next steps that you'll need to take before applying. The first thing would be to sign up for the TI newsletter to be kept in the loop about all of the new information for Justice, to review the TI application requirements for Justice. In order to avoid future problems, please confirm all of your clinics and providers are accurately enrolled with Access and credentialed with the contracted MCOs. Make sure to submit the TI provider interest form by June 30th, 2023. And before the final step of submitting the document, the application on September 30th, make sure to prepare by gathering the documents and attending the assistance meetings. Just to go over a few more of the technical requirements with the Access Online portal, participants must have an active Access provider number, TIN, and NPI. Participants must have an active Access Online account with access to TI portal. There are going to be different types of accounts, so make sure that your organization has at least one master account. If you don't have a master account, make sure to submit an application for that at least 30 days prior to the TI application deadline. These are the important links that will have more information about any questions that you have. So make sure to sign up to the TI newsletter and submit a provider interest form. Now we'll move on to the Q&A portion of the presentation. So feel free to come off mute to ask your questions or put them in the chat box.
Is there a way to download the interest form without completing the actual document? I saw that you can save it, but I was just wondering if there's a way to, you can save your work and go back, but is there a way to print that out?
Not currently. Can you give us some idea of why you want that, Lisa?
Some of the information I don't have readily available. I can write it down, of course, as I'm going, but because I did see that you can save it. I was just lazy that day and didn't create an account, but to save it, but just inquiring.
Yeah, makes sense. Makes sense. Yeah, we don't have that available right now. If it's something that's super critical, and you have a business need for it, let us know, and we can see about transcribing it. It'll just be a very manual process for us. So let us know if it's super valuable, and we can get somebody on it.
Thank you.
Question in the chat from Mark. How is the amount of seed funding determined for each awardee? Very good question. So we are looking at following a similar format to TI 1.0, where tip justice clinics that are accepted into the program will receive a bit of a block funding incentive. So it'll be a set amount of funds for each clinic. If you are a new clinic and new justice partner, it'll be a larger block of funds than you're an existing tip justice clinic and partner. And so that amount is to be determined. Again, we have a fixed pot of money and an unknown number of applicants, and we need to review those applicants and kind of see how many ways that pie is going to be sliced before I can give you kind of an estimate there. Sorry, I can't really be too much help in that estimate regard, but just so that you can kind of expect the structure, I guess you can say. Any other questions? The follow-up question, can Access provide historical milestone rates to help inform what possible reimbursement amounts may be realized? Thinking through that one really quick. Can we provide? Yes. Will they be meaningful? Probably not. Again, the funding structure is going to be, it varies a little bit from year to year, and without knowing how many folks are going to be participating and which proxy we're using for payment. For example, what we're looking at proposing right now, what we're planning is looking at the block funding for the year one. If you're accepted into the program, having that block amount. And then after that, looking at number of individuals that are involved with the criminal justice system, referred to you from a justice partner. Every individual seen by the clinic would count as an individual that we would tie to the incentive. And so depending on the number of individuals that were served, and we apply a rural differential to it, that usually drives the rate. It's also about how much aggregate funding we have. And so, how many, we have fewer milestones in TI 2.0 than we did in 1.0. And so the milestone rates from TI 1.0 will be largely not applicable to 2.0 here. So a short answer is yes, but it won't be helpful. Mark, you had a follow-up? You want to come off mute?
Yeah, I just wanted to thank you, Cameron. I know it's very nebulous at this point. I'm just trying to help inform internal discussions we're having over here about, potential levels of upfront investment we'll need to make and how to position ourselves for staffing, operational costs, et cetera. To just kind of dial in the proposal in ways that make sense and in line with the incentive, the downstream payments. So thank you for your response, I guess. Thank you.
You're welcome. Sorry I couldn't be more helpful, and I absolutely understand the position that you're in doing that planning pace, working out that commitment letter plans with your justice partner, what the next 5 years are going to look like, to know what the incentive fund's going to look like, for planning purposes. Very important. I wish I had a crystal ball and I could tell you how much it would be, but my crystal ball is not always accurate, and I don't want to mislead you. See, we got another 18 minutes here. Any other additional questions, comments, concerns, thoughts, ideas? Give it another minute or so. See, maybe since we have a few minutes left, Vishal, would you mind going to the application criteria? We're just going to go through the optional. We put it into the chat here, so everybody can have it. I just kind of want to go through some of the optional criteria. We are in the middle of updating this application document for a few more specific things. Again, we are in the planning phase still, right? And so we are also trying to keep things up to date and as meaningful as possible. And so as we review some of this stuff, we do have a couple edits. So you see the EHR system, we already mentioned that in the PowerPoint as being an update. We are again working on updating this PDF to reflect that. Scroll down a bit more for me. So two specifically that I want to focus on for the required criteria. Keep going, Michelle. So right here, if we could stop. Bottom of the last page, if you would. Yep.
This one?
Yes, thank you. So we are going to require, well, as part of that that partnership, right? Part of it is sharing data. And so we need you to have a way of identifying an individual's criminogenic needs or criminogenic risk. Usually that is a screening that is occurring by the justice partner, either at time of booking or at time of release. And so, there's similar screens that the clinic may be doing as well in order to identify that individual's health-related social needs and really just healthcare needs in general. It's really important that the provider serving the individual as well as their justice partner are on the same page. And so we are going to be updating that requirement to require specifically sharing and communication of that criminogenic risk score for individuals that were referred to the clinic and that the individuals that the clinic is serving. See, going through, if you can go down to the optional criteria for me, please. We're looking for peer family support. So we are adding a new optional criteria, optional required, and then updating one as well. So that first line for ensuring access to multiple forensic peer and family support services. We again seen a lot of success in that in TI 1.0 for many reasons, but being able to connect with individuals, and engage individuals, that have that lived experience, it's so important. And so we are going to update that line specifically to really require peer family certified peer family support specialists and really encourage those specialists to attend, either be trained at a organization that specializes in forensic support already, or if they were not trained and certified through those organizations, then being able to take an 8-hour forensic peer support training program through the AHCCCS. So more on that will be kind of listed out here. I just kind of want to call that change that is pending, and another one as well. So if you do plan on working with multiple criminal justice partners, so you'll have probation or parole that you'll be working with. Maybe you're working with courts as well, or maybe police, in order to provide more crisis response or crisis services, for example. We recognize that the criminogenic risk and needs of those individuals, the populations served, referred from those agencies are going to be very different. And so if you do have multiple criminal justice partners, we are going to require an explanation of how the clinic's going to apply the risk, needs, and responsivity principles to integrated service plans and the service provision in general. based off of those individuals' criminogenic risks specifically. And so basically looking at, keeping the folks kind of separate for the folks that went, maybe to prison, for 20 years and are now serving parole, from the folks that maybe have been involved with the police once or twice, being able to kind of keep them in separate treatment groups is really important. There's plenty of studies, I can always direct folks to those that really enunciate why that's important, and really need to see that from folks as we look at expanding into additional justice partners. So, yes, Mark, we can share a link to that. Let's see. Yeah, we will follow up after with that link. I don't immediately have it available, but we will make sure that when we update the eligibility criteria here, that it is also listed. Make a note of that now. So I know those are two completely new things that are probably off many of your radars. That's why I wanted to include it here for the recorded presentation and for future presentations. It's really important in getting questions here. So from Deborah, would you accept the Ohio Risk Assessment Scale in place of the R&R? I would say if it is getting to the same model effectively or to the same goals, we would be open to it. I'm less familiar with the Ohio Risk Assessment Scale, so I would want to have a discussion maybe with you on that. I'm going to pause for a second, just noting that this is not my area of subject matter expertise. If there's anybody else on the call that would be able to say the Ohio Risk Assessment Scale, should be allowed or should not be, or just kind of give that opportunity here now. All right, no so much luck, but that's okay. Deborah, follow up with me after if you have concerns on using it specifically. Again, if it is a similar, kind of framework as R&R, then I think it gets to the overall goal. If it's something that's only loosely related, then I want to make sure that we touch base on it and make sure it's going to be applicable to whatever populations you're planning on serving or planning to be served. Learned something new today. Thank you, Deborah. Any other questions on anything we just covered or really anything in the past hour? All right, well, hearing none, please have a good day. Thank you all for joining us. Thank you, Deborah. I will definitely research into that. And if it's more intensive than RR, then it'll probably satisfy our true intent here. But we'll get back to you on that one. Thank you. All right. Well, thank you all for joining. Have a wonderful day, a wonderful week, and we will touch base soon. Thank you all.